purpose of this today is in a format where we're just kind of conversational, talk a little bit more about the concept of Sagittal First and the product, and kind of just kind of go through some of your thoughts and ideas of how it all came about and why it's so important to clinicians, to staff members, and most importantly to patients. It's all motion all day, every day, whether it's my class 2 cases, my class 3 cases,
and
whatever.
class 1 cases, because
and class 1 chronic cases.
And asymmetry cases. That's what I wanted to bring up. Mm-hmm. Yeah, that we're just now touching the surface of how much it can help us. Yeah. I was walking when we went for a cup of coffee with Dan Aboud, who's here from Australia, and he's done a fair number of class 2s, and he's starting to do some class 3s. I said, wait till you start treating this asymmetry patients. Mm-hmm. And he was like, well, how does that work? And I said, well, I saw Luis show 1 or 2, and now it's like, it's not an issue, no surgery. It's like, it's easy. And that I think is going to really change the world for a lot of orthodontists, because they're the hardest patients to treat.
I think it's going to pique a lot of interest in people that normally think, I got this, I know what the thing is, I know what it does, but nobody has mastered asymmetry yet on a routine basis.
I sort of feel like I have. I mean, that's kind of a cocky thing to say, but
it's simple. It's
very
even
simple. It's totally
simpler because you have to wear the half.
Yeah, we don't. There's no protocol change in our practice anymore, and that's what I really love about it. Is our staff knows every step, every way. It doesn't matter whether it's class 1, class 2, or class 3. These are the things that we do for all the patients. So these asymmetry cases, they fall right in line. There's nothing unique about them anymore.
And the asymmetry cases are the reason, if people go, is it 3D just because it's a trendy thing to put on it? No, we're literally changing faces in every dimension now with very little effort for the patient.
It also translates over to, when you're talking to the patient, the mom or the adult patient on the front end. Sometimes they get hung up. Are we going to do aligners? Are we going to do braces? So now, and that could be a sticking point of if they're going to start or not. It's not a sticking point anymore.
It's see them relax when you tell them. Well, you don't have to decide right now, and it's like.
Right. One of the most complex things, in my opinion, is to solve the sagittal dimension, and the accomplishment of the adequate position in the sagittal dimension is probably one of the most difficult things that we face as orthodontists. So, accomplishing a class 1 occlusion. First of all, we accomplish a beautiful functional occlusion at the beginning, and we generate a scenario of perfect fit of class 1 in a locking scenario. No? Mm-hmm. Then the second part is easy. We can switch into aligners, we can switch into braces.
Let's back up a little bit, if we may, and talk about Sagittal First, pre-motion 3D, of what it was like in your practice too, when you would see a typical class 2 patient, whether it's 3 millimeters or 4 or 7 millimeters of overjet come into your practice. What would be going through your head in terms of your approach to that case and some of the challenges that you would expect?
It's like that was always one of those things where, you'd see the case and you go, can I do it in elastics? And then it's like, oh, no, I can't. I got to do a Herbst appliance because that was my go-to appliance.
And so typically I would have used a Herbst in the past. And a Herbst appliance is the only real emergency that an orthodontist ever sees. Herbst breaks, and doesn't matter what time of day it is on the weekend, you got to go in and fix it because they can't close their mouth and everything else. So transitioning to using the motion, you immediately remove the only emergencies that are truly emergencies in orthodontics. Right. And so as an orthodontist, that simplifies my life amazingly. And now that I've been using it for 4 or 5 years, when patients come in for a second opinion and the first opinion showed them a Herbst appliance, and I still have one on a model, I said, oh, you mean this? Yeah. And I said, we can get the same or better result with this. Yeah. And every single mom, the light goes off and go, well, tell me how that works.
It dawns on me that when you're trying to tell a patient why they're wearing rubber bands and doing it the way that we used to do it, 4, 5, 6 years ago, they have no idea what it is we're trying to do, especially because the changes happen so slowly. And their teeth are already all strapped up in braces, and they've been doing this for a long time. Everything feels the same. You do it differently by treating it at the beginning and they feel and see the changes. So, man, you talk about keeping their head in the game.
The old standard was to use a herps, basically, for most of the orthodontists in the world, right?
For large Class 2
Class 2
corrections. Not even
corrections.
large, frankly.
And
anything over half cusp.
Exactly.
For me,
And even then, you would have to wear rubber bands continuously afterwards to hold it there. And so the new standard, and I love when Jep talks about his lunchroom experience patient, that he describes using the Motion 3D, and the kid goes, oh, everyone at my lunch table has one of those. I mean, it's becoming the new standard. And when you showed him the Herbst, he goes, no, the Motion 3D is great.
First time I was introduced to Motion 3D properly, and that was by you in 2015, September.
Yeah.
Utterly transformed my practice that day, because I, was watching these cases, and I'm looking at case and timeline, and I'm like, first of all, I'm not doing that result, and second of all, I can't get even remotely close to those timelines, in my case results. And so the only variable that was different, because I was passive self-ligation, same arch wires, same treatment philosophy. The only variable that was different was the Motion 3D. And so that, I sat there and said, okay, I'm going home, we're getting a kit, and we're going to start. And that was the moment that my practice, it literally was a paradigm shift in our practice.
Now you're an expert, a global expert. Eh?
No. I'm a young Padawan.
No, you're a super expert.
It's it's not really a young Padawan. But it now has become one of those things in our practice that our staff looks back on it, and you want to talk about practice happiness. Yeah. With the protocols that we have done and the paradigm shift that happened within the practice over the last 2.5 years. It's everybody knows where everything's at the whole time, regardless of whether they're Class 1, Class 2, or Class 3. And it's just like plug and play. And our treatment times now are down to Class 1s. We're getting 9-10 months. Class 2s, I'm predictably at 14 to 16 months for Class 2s. And I'm not talking quarter cusp Class 2s. I'm talking three-quarter and sometimes full step.
Well,
it's unbelievable.
Just compare the difference in complexity, both in the mechanics, but also just frankly starting a patient with something like a Mara appliance or a Herbst appliance. Everything you've got to do. You've got bands, you've got separators, you've got cement, you got to do all this. You've got arms, impressions, the whole thing. Now start thinking about the simplicity that happens when we decide to start a patient, whether it's Class 2, Class 3, and it is a couple of bonded appliances, a couple of brackets, and a retainer of some kind, and away they go, out the door. I mean, you talk about easy for the patient, I'm talking about easy for the doctor.
That was another transformation in our practice, because when we onboarded with the Motion 3D, we turned around and our, same day starts. That was a heavy emphasis in our community. And it's just one of those things in the U.S. So do our same day starts, but that is an onerous time commitment on the schedule. 60 minutes, 45 minutes at minimum.
You use a word there that I think is pretty important, because you said onboarding. We do that all the time in orthodontics. You don't even really, there is no real onboarding with this. I mean, with Motion 3D, it's just like learn how to put that on a tooth.
The Motion 3D works predictably, exactly the way we expect it to, on every single patient, with the only limiting factor being compliance. And they're so excited at the beginning, that is not a problem. Maybe one patient a year.
And try to think about the emergencies that we have with the Motion 3D. They don't exist.
Yeah.
They just don't, there aren't any. They just don't exist.
But one of the things that is very interesting is that the patients and the mothers and the parents and everybody involved around the treatment, they understand our project. Mm-hmm. They understand it. They understand the steps that we are following. We are looking for a Class 1. We are looking for establishing a perfect occlusion of the posterior segments. Yeah. And afterwards, we are going to align your upper teeth, align everything, settle perfectly, beautifully with these beautiful appliances, and we will end up your treatment. So everybody in the family, they beautifully understand which is the protocol, which is the effect, the SagittalFirst concept, the concept of establishing a perfect matching occlusion of Class 1 with the Motion 3D appliance, and the patient becomes an expert of the orthodontic treatment.
That's right. I mean, Luis, think about if we even described it at all to our patients, what we were doing, there was so much going on in their mouth that it was almost impossible to singularly identify what is it that you're actually doing. If there's only one thing going on, I mean, if there are no brackets, there's nothing other than a couple of bars and a bracket that you're wearing a rubber band to, all of their focus is on exactly what is happening in their mouth. They get it. And we're actually, at least in my practice, we're actually explaining it a lot better to our patients than we did prior, several years ago, before I was using the Motion 3D protocol in my practice. We just wouldn't even say anything. We're just like, wear your rubber bands. That's all you got to wear your rubber bands. Now they're looking at the photos. Yeah, they're understanding.
The Motion 3D appliance has taken off incredibly, especially the last couple of years. It's become the fastest growing appliance sold around the world. It's become the #1 device for both Class 2 and Class 3 correction. But my question for you is, what would you say to colleagues, docs that you come across that haven't yet started using the Motion 3D appliance or the concept of SagittalFirst with Motion 3D and are still somewhat skeptical? What would you say to them about if or why they should start and how they should go about it?
Trying to introduce this to somebody is, what have you got to lose? You're not changing your bracket systems. You're not changing anything. You're using something that can be used in anybody's hands very easily. Easy to teach staff. Easy to do you teach the patients. Mm-hmm. I would say, what do you got to lose? Try it.
My second favorite thing is no bands. I cannot stand banding patients. I hate it. I hate watching my staff. The patients can't stand it. God forbid you still have one of those reciprocal thumpers in your office. Oh my gosh. I mean, can you, thunk, 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 thunk. So, but as far as no bands are concerned in the practice, we've utterly eliminated them. I can't remember the last time I seated a band in our practice. I mean, I think it's been well over a year now because I bond 6s and 7s as well. Right. And the mom's like, what do you mean you're taking the bands off? I'm just like, I don't need them. Why don't you need them? And then there's a whole nother explanation. But I love the Motion 3D for that reason. No bands, simple to place, and not only is it simple to place, it takes literally 3 minutes of doctor time to place it.
One word to describe what SagittalFirst with Motion 3D has meant for you in your practice.
Transformative.
Transform my life, yeah.
Transformative. That's
Happiness.
not one word.
Happiness.
Satisfaction of the customer.
Okay, that's
customer,
not one word.
Yeah,
that's about 9 words. That's one word.
What satisfaction?
I truly, I'm going with happiness because the patients are happier. My staff's happier. I can tell you I'm happier. There's so many, we've talked about the multivariable effects clinically about the appliance. There's multivariable effects on my practice. Yeah. All right. Yeah. Minimal emergency appointments. You referenced that earlier, Dave. There is really no emergency appointment with the Motion 3D because you tell them to stop wearing the rubber bands and come see me Monday. Because of the predictability in the practice, you have better workflows. And overall, everything is, I walk into my practice now and there's very few problems going on. And the cool thing about that is now we have time to attend to the really, really difficult things and give it the attention it deserves.
I would say my single word would be predictable.
Predictable, yeah.
I mean, it's so nice to be able to walk into the office in the morning and know exactly what's going to happen and not look at the schedule and go, oh, I still have to deal with that. I mean, predictable makes my life so nice.
Absolutely.